Hi, I'm Felicity, a registered nurse, cosmetic injector and clinic owner. Welcome to my channel, The Fit Injector. Occlusion to the nose from dermal filler. There is a case circulating on Instagram right now from the UK. You've probably seen it if you follow a few injector pages. Now, when these cases, unfortunately they do happen, but when they do circulate on the internet, I often get clients asking me questions about them. So I wanted to address you here to hopefully raise awareness, not to terrify you, but just to make you really aware of the risks and also help you to make a really informed decision on who injects your face. Now, before we dive into the story, the main point I want to make here is any dermal filler to any area in the face, to any injector, even the most experienced, these treatments come with these risks. Now, not to scare you again, but just to really make you aware, I want you to ask yourself this question if you are having cosmetic injectable treatments. Do you feel confident in the person injecting you that if something doesn't go to plan, they will know how to manage it? Because early intervention is key with these cases. So let's jump into the story of what happened to this poor lady in the UK. Now I'm going to read out her story. So what happened is she had dermal filler injected into her nose by what they call in the UK as a non-medic. Now here in Australia, you would know that as a beauty therapist. I absolutely love beauty therapists, but the point here to know is they are not medically trained. They are not a registered nurse and they are not a doctor. Unfortunately, the regulations in the UK actually allow anyone to buy product and inject product, which is really scary. And unfortunately, in most of these cases that happen with adverse events, they are from non-medically trained people who are injecting these products. So very soon after the injection, she went home, and what she's written on the internet was that her nose went white and cold. She went home thinking that this was normal, that this was just a little bit of a pain after the injections, and obviously reading this, the risks had not been explained to her or the things to look out for after her treatment. Now, the following day, she woke up with bruising across her nose and now multiple white patches. She was in a lot of pain and she was really cold and said she started shaking. She contacted the lady who injected her and she was told, quote, "It was nothing to lose sleep over." She was also then informed that the lady had used a new filler, which she was not aware of prior to her treatment. So whether she'd even had training in that particular product, whether it was even a suitable product to be going in her nose. Now, I'm not aware of any further details around this in terms of what training she had had and what product she was using. That was obviously not mentioned in the post. So she was then told that if she did need to have it dissolved, that there was absolutely no rush and she could continue with her weekend plans. She was told to rest and take aspirin. Things continued to deteriorate for this lady and she was referred by the woman injected her to one of her friends for dissolving, as the lady who had injected her by that point had gone away and she was not at her clinic. The dissolving did not happen until the following day. So this poor lady spent another night in agony, completely unaware that her nose was literally dying by this point. So we're now at the following day and she's gone to this clinic to have her first attempt at dissolving. Now, this was unfortunately unsuccessful. She said it was excruciatingly painful. It was not a good experience. After, when it was revealed that it was unsuccessful, the person who injected her revealed that she'd never dissolved filler before. She obviously had absolutely no idea what she was doing, and she cost this lady more precious time. So I don't know anything more about that particular injector, but it sounds like she had absolutely no training in what to look for when things go wrong and how to dissolve. She should not have been referred to her, or she should have straight up said, "I am not skilled enough to deal with this," and been referring her to someone who was. So we've now lost a whole nother day. At this point, she was referred to the consultant clinic. Now, they are a doctor-run cosmetic clinic in the UK. You may follow them on Instagram because they provide complimentary treatment for disasters like this. Unfortunately, they do deal with a lot of them due to those lack of regulations that I mentioned earlier. They are a fantastic clinic, and hats off to them for taking on board these particular cases. Go and check them out on Instagram because they have put up a lot of information about this case, and that's where I learnt about this case. So she went to them and they properly dissolved. So this is a second attempt at dissolving, but of course they did it properly because they know what they're doing. Then they also referred her to A&E, or in Australia we call that the emergency department, for further intervention. Now I'm going to put a note on this. A&E or ED apartments, they are not trained in cosmetic injectables. That's obviously not something they're doing. They are also not trained in the complications. And if you do go to them, you'll probably be told you either have a bruise or an infection. In this case, she was initially told that she had an infection. And the consultant clinic doctors had to liaise for her to be properly treated. Once they got that point across that she needed this treatment, she received IV antibiotics and steroids, and then was referred for hyperbaric oxygen therapy. Unfortunately, this woman is not in the clear yet. She will continue to have hyperbaric oxygen therapy for a further 2 weeks. So this only recently happened just last week. She will then see a plastic surgeon to assess the damage and for most likely further treatment. Now, the doctors she has seen already have already informed her that she will be left with scarring. So how could this situation have been handled properly? So if she had seen a medical professional in the first place, they would have used the correct filler in the correct areas. They would have been well aware of facial anatomy. They would have advised her of the risks prior to the treatment and also the things to look out for when she went home. They would have performed what we call a capillary refill check after the treatment. Often, most of us will do that multiple times before we let you go home. Had there been a blockage at that point, which reading this, there probably was before she even left that clinic or salon or wherever she had it. And the dissolving agent would have been administered immediately, and she would have remained in that clinic, and that dissolving agent would have been repeated and repeated until normal blood flow had returned. In most cases, with that quick intervention, no further treatment is needed and no damage will happen to the surrounding tissues. So if your injector is not a registered nurse or a doctor, if they don't explain the risks to you prior to the treatment, if they don't inform you of their particular protocol, if there is an adverse event, and how to contact them once you leave the clinic with absolutely any concerns, then I say don't even proceed with the treatment. And for those of you wanting to become a cosmetic injector, it is not as glamorous as you think. You need to be prepared to be on call 24/7, 365 days a year. You need your clients to be confident in you, that you will answer your phone after hours and you will do it in a quick manner, and you will come to the clinic, even if it happened to be in the middle of the night, to provide any treatment that your client needs if they are having an adverse event. I hope you found this case interesting, not to terrify you, but just to make you aware of those risks and things that can go wrong, and hopefully help you to make a really informed decision when you go for your cosmetic treatments. Now, make sure those questions are being asked, those things are being explained. And if you want more information, did you know you can actually ask your registered nurse or a doctor to provide their registration number, which is a legal requirement in Australia to be registered as either a nurse or a doctor. So just ask them for it. They should have it either on their website or somewhere in the clinic, but if not, if they've got it, they will be more than happy to bring that up for you and provide that. Give me a thumbs up if you enjoyed this video. Drop any comments below. Go and check out this case on Instagram. There's a lot more information circulating around it, and I'll see you in the next video.